Hi guys, I believe we are doing okay. My name is Omataya Keremi, and today I just want to answer some frequently asked questions about kidney failure. So, people that are living with kidney failure frequently ask some questions about this disease, and so I've tried to put together four questions that are mostly asked about kidney failure. So, the number one question is people always ask that now that I have kidney failure, does it mean that my two kidneys have failed? So this is one important question and crucial question that people usually ask about kidney failure, especially those that are already surviving on dialysis. They usually ask if it is their two kidneys that are failed. So my answer to this question is yes, unfortunately, because before someone will get to a stage of kidney failure, which is the end stage chronic kidney disease, where the estimated glomerular filtration rate is less than 15, apparently thousands of nephrons must have been destroyed. And if one kidney is working adequately without any challenge, the nephrons will still be working, and the estimated glomerular filtration rate would not be this rate. And also, with just one healthy kidney, we can live a normal life. One healthy kidney is enough to sustain us a lifetime. Apparently, there are some people that have just one kidney from birth, and they don't even know this until maybe when they have to do some employment medicals, or maybe during their migration medicals, before they get to know that they only have one kidney. So one kidney is enough. When the two kidneys are bad is when someone has kidney failure. So number two question is, despite that I have dialysis few days ago, my creatinine is still high. My answer is that our kidneys work every second to get rid of waste from our body system. And when the functions of the kidneys declined, this waste will keep accumulating in the blood. And there is no sections of dialysis that can equate how the kidneys work. There is no sections of dialysis, there is no amount of sections of dialysis that can equate the functions of the kidney, or how fast the kidneys get rid of the waste. So yes, technically there will be accumulation of waste in the blood, which includes the creatinine and the urea and others. And if someone is not actually faithful to the section of dialysis, there is risk that the value of creatinine will keep increasing, will keep going higher. And so in order to lower the rate, or lower the value, or lower the creatinine levels, we need to actually embrace regular dialysis. But yeah, what of the finances? That's one of the major challenges that people do face when it comes to treatment of kidney failure. So kidneys work every second to remove waste from the body, and the regular dialysis can make the level of creatinine to increase. So that is my honest answer. And my next question is, patients that are surviving on dialysis sometimes do ask why their blood level keeps going low, even though they just had transfusion. So I will just put the question as, I took my blood transfusion and my blood level is still low. Why? So my honest answer is that one of the functions of the kidneys is to secrete an hormone that is called erythropoietin. So it's this erythropoietin that helps to stimulate our bone marrow to produce red blood cells, to increase the volume of our blood. So once the functions of the kidneys declined, the erythropoietin secretion will automatically reduce, and so there will be nothing to stimulate the bone marrow to produce the red blood cells. And in order to keep up with our blood volume, there is need to take this injection called erythropoietin stimulating agent. So this will now help to maintain the production of red blood cells in our body. So I hope I answered that in a simple way. So my next question is, the question I have next is about fluid. So sometimes people do ask that they've always known that it is good to drink water. Water will help to keep the kidneys healthy. Water will, make kidneys to work well, to be good. But that's why their feet and their face keep swollen anytime they drink water, even after dialysis. So my answer to this question is that water is actually good for our body system, and it's good for kidneys only when the kidneys are healthy. So when the kidneys are healthy and we drink enough water, the kidneys can get rid of the excess fluid. But once the functions of the kidneys declined, drinking fluid water is not good for the kidneys at that time, because they cannot easily get rid of this excess fluid. So once you are having kidney failure and you are not making enough urine, you have to reduce the way you drink fluid. At that moment, drinking fluid is not going to be healthy for the kidneys. So you have to reduce your fluid intake. So that's that. Then my last question that I have here, one of the questions that people always ask about kidney failure is that people get tired of dialysis after some time, and they get to ask that, is there any other treatment option aside dialysis? Because dialysis seems to be exhausting, time wasting, and the multiple hospital visits can be challenging, and if there is any other treatment options. My answer is yes. Currently the only treatment is kidney transplant. Kidney transplant has overall benefits than other renal replacement therapies, and of course the benefits outweigh others. A successful kidney transplant actually gives new hope to a person that is living with kidney failure. And of course, if you are a good candidate for kidney transplant and you have the resources, I will advise to embrace kidney transplant, because it has overall advantage, benefit to other renal replacement therapies. So that being said, I have a take home from this our talk today. Kidney failure is fast becoming a non-communicable pandemic whose treatment incurs high financial burden on an individual, society, and the government. So let us all see how we can actually care for our kidneys so that they will not fail us in their functions. My name again is Omotayo Akeremi, and I hope we've all learned something from these frequently asked questions about kidney failure. See you all. Bye.